From the KLIF 24/7 newsroom, news and information, 570 AM, 96.3 FM, HD2.
KLIF.
The doctors told me since, 2 spinal fusions, I gotta, can't play Major League Baseball anymore.
Poor old Prince Fielder.
Yeah, emotional remarks made by the Texas Rangers player yesterday.
He was just choking up, and he got to a point where he was pretty much just weeping uncontrollably with his 2 young sons sitting next to him. Mm-hmm. But as he said in that news conference, he said, I've been in Major League Baseball clubhouses since I was their age.
Right, because his dad's a former major leaguer.
Cecil Fielder. They are the only father-son duo in Major League Baseball history.
Really?
To have both, well, I think there have been other, but they both hit 50 home runs in one season at the same time, at the same season.
Wow.
And they both wound up with the exact same number of home runs for their careers. So it's
he's out of the game, but he's not retiring because he still wants to be able to collect his salary. Dr. Pablo Zeballos is a pain management specialist at Spine Dallas and has a background in sports medicine. He joins us now live to talk about the kind of injuries Fielder has been dealing with and what it means for him in the future. Good morning, doctor.
Good morning. Thank you so much for having me on.
Thanks for joining us. So can you describe the injuries that Mr. Fielder has suffered over the years and how it has affected this outcome?
Yes, definitely. The interesting thing is in baseball, you don't see many of these type of injuries. You see it more in football and rugby and more contact sports. In his case, he's had a neck pain and neck injury, which has started causing a numbness of his arm and some weakness of his arm. And that's why he had that first fusion back in 2 years ago at the C5-6 level. And apparently now he had a level above the C4-5, which started causing some of the similar symptoms, and that's why he had to have a second fusion. And those are the thing with baseball. Obviously, you have to be able to feel the bat, be able to feel everything, and be able to have the perfect strength for that. And obviously this was affecting him, and that's most likely why he was now basically disabled.
Yeah, doctor, having played baseball myself when I was young, and I played at golf a little bit, and it occurs to me that swinging a bat or swinging a golf club has to be pretty much the most unnatural movement that a human being can make. Our backs don't seem to be designed for that kind of thing. Was Prince Fielder's problem basically because of the construction of the human body? Was it genetic, or was it an accident, or what?
I think most likely, what you have to realize is the disc are like shock absorbers in our spine. It's really what helps, between the bones. And the disc is its weakest when you rotate, which is basically turning your head, and actually side bend. So when you're playing golf and doing baseball, that rotation puts a lot of pressure on the disc. And so what happens is, if you already have a genetic predisposition to have a weak disc, if you already have family history of that, then obviously doing the rotational forces, that torque that he does, the kind of violent torque when you're sitting there, twerking your neck and the ball, that can obviously accelerate any type of injury in his case. So in his case, most likely, I'm not his physician, obviously, so I cannot tell you for sure, but I don't think there's any history of any type of trauma and so forth. So most likely, he had a genetic component that obviously got accelerated with this torque, with the baseball. If you look at the way he hit the ball, man, he hit it so hard, and it's just most likely a little bit more of a natural stroke.
Yeah, he certainly has one of the most violent bat swings in all of baseball.
So is he done for good? I mean, he hasn't retired. They put him on the disabled list, but that's just so he can still collect his salary.
That's exactly correct. Once he's medically been not cleared, especially if he's had a 2-level fusion, most likely he will not be able to return. If you have 1-level fusion, you can still have, your neck can still turn pretty well and so forth. You have less restriction. Once you have 2 levels, it's much harder to be able to turn your neck in a more natural way, number one. And number two is you're also at higher risk of injury. So if the ball hits you in a traumatic event, you don't have as much space or as much give in the spinal cord or the nerves to come out of the neck, and so you're at much higher risk of obviously injury.
What about his life? He'll still be able to have a normal life outside of sports, right?
Oh, no doubt about that. No doubt about that. He'll be able to bicycle, play with his kids, do everything normal. Once he has that fusion, it basically stabilizes his neck. He will just not be able to do that. Obviously, the high impact baseball that professional elite athletes have to do day in and day out. So yes, he'll still be able to do normal things and so forth. The thing you just have to watch out is make sure the level below that C5-6 where he had the previous fusion is make sure that level below doesn't get affected. A lot of studies do show that once you have one level fusion, you have about a 25% chance within 10 years of the level above or below also degenerating and having a herniation or a disc bulge also.
This may not be your area of expertise, but I'm just curious if you have any thoughts on this whole cupping sensation that's going on in the Olympics with Michael Phelps.
Yes, definitely. So let's talk about the cupping. The cupping has been around for quite some time. I mean, many thousands of years ago, actually, obviously, in Eastern medicine. So it's been used for many years, even before we were around, obviously. It's one of the things it's being used. The whole thought behind it is by doing the cupping, it's supposed to increase blood flow and blood supply towards the tissue, and it's supposed to get rid of all the toxins. It's supposed to improve your recovery for athletes and for anybody else, basically. It's one of those things that's been used. However, if you look at the scientific studies, there's no scientific basis behind it. There's just no significant large randomized control studies. There's just no Western-based medical journal studies that actually show any benefit for it. So it is being used. It's been used for many years. Athletes are now using it. The way I tell my patients are, as long as it causes no harm, go ahead and use it. And so whether it's a placebo effect, then go for it. It's kind of like those tapings that you see, the kinesiology taping that you see on athletes nowadays. Same basis. There's no significant evidence-based medicine that shows it is significantly improving any of their conditioning or recovery. However, if in your mind it's going to make you feel better or you feel less restriction, then go for it, basically. That's what I say.
I'm going to get rid of these magnets I've got in all my pockets.
That's another example right there, basically.
Tomorrow he's going to come in with red marks all over his body.
Okay.
Exactly correct.
Dr. Pablo Zeballos, thank you very much. It was great talking with you, and maybe we'll have an opportunity to do so again. Appreciate it.
Definitely. Thank you so much for having me on board. Thank you.
Dr. Pablo Zeballos, pain management specialist at Spine Dallas.